Welcome to My Bad Feet. Yes, I said it. That's the name of the show, My Bad Feet. And I'm Dr. Maasi Smith, a practicing foot surgeon in Philadelphia, Pennsylvania. I want to welcome you to my very first show talking about bad feet. And a lot of people ask, why did you come up with that name? Simply because a lot of my patients will come in and say, Doc, can you fix my bad feet? And I say, yes, I can. So we have a very interesting show for you today. We're going to talk about bunions and hammer toes. Yes, I said that too, bunions and hammer toes. So a lot of you grab a seat and hold on because we want to show you some very, very fun stuff. A little bit about me. I practice in Philadelphia, as I said. I went to Temple University School of Podiatric Medicine. I grew up in New Jersey, and I'm more than willing to share all my experiences with foot health with you. We're talking in terms of diabetes, peripheral vascular disease, and we're going to do future shows on those type of topics, and plus many more. There are so many foot problems out there you can't imagine, but I'm here and I'm going to enlighten you on a couple of problems today, but then we're going to talk about it much more later. Let's tell you a little bit about my website, MyBadFeet.com. MyBadFeet.com is an experience. If you go to my website, we have videos, we have a blog, we have links, we have tons of information to really keep you informed about your feet, as well as other health issues. We have a general health column that'll give you information on other health problems besides your feet. But I'm going to focus on the feet today. And like I said, the first thing we're going to talk about are bunions. I get a lot of patients from day to day in my clinical facility that come in with bunion pain, one of the most common issues that I see. Some of them and most of them have to be fixed surgically. A lot of people are apprehensive about that. So what I want to do today is give you some insight on the type of procedures that can be done. There are many more, but I'm going to give you the basics and the most typical procedures that I perform. Also with hammer toes, we're going to talk about hammer toes. Yes, I said it. I know a lot of you are walking around with those painful hammer toes, or they may not be painful. You may be curious about what causes a hammer toe, and you may be interested in receiving treatments in reference to hammer toes. I'm here to give you information, some insight, and I'm here to help. Foot care from the doctor who cares. That's my motto, and I'm here to help. Let's go to some interesting video on my website, MyBadFeet.com. Let's take a look at something. We're going to first talk about a bunion. And the great thing about my website is, again, these videos allow you to be sort of interactive, where you can go to each step and you can kind of look at each problem or how it progresses with a bunion. As you can see, a bunion is basically that big bump on the medial aspect of your foot. Occurs a lot in a lot of people. There are thousands of people walking around with painful bunions. Well, I'm here to give you some information on them. As you can see, the little circle right there, it has pronated foot. Basically, that's when somebody's foot kind of twists in and their ankles kind of twist in. And it's kind of hard to explain, but if you look at that video, it shows an excellent diagram of it, and that can kind of increase the incidence of bunions. And you know what this looks like. These are people with flat feet. People who look like they're walking basically with no arch whatsoever. This can, people with high arches can also have bunions, but this is the most common foot type that can cause bunions, and it's called pronation, fancy word for flat feet. Let's go to the next step here. As you can see, look at the little red spot right there. This is where bunions really cause a lot of problems with my patients. It could be the type of shoes that you're wearing. It could be genetic, and yes, you can get bunions from your family members like your parents, and yes, they probably did it to you. But the one thing to remember is that you're genetically predisposed to having bunions. Not necessarily. It's not that you're going to definitely get them. It's just that there's a possibility, or you have a stronger trait to actually have bunions. And let's go to the next step. And treatments, as you can see, changing shoes, bunion pads, orthotics, avoiding painful activities, and surgery. Avoiding the painful activities is a little bit difficult because people want to continue their daily living in their life, and they don't want to be hindered by foot pain. And trust me, foot pain can cause you a lot of issues, but I'm here to help with that. Changing shoes often helps. A lot of us wear shoes that are way too short, and we have to learn to shop for shoes that are either, if you have flat feet, you need a wider base in the distal aspect of your foot, basically where your toe box are, and you have to wear a wider shoe to be comfortable. If you have flat feet, you need a wider toe shoe, a wider shoe box, in your shoes, and you have to be cognizant of that when you're looking for shoes. Bunion pads offer a temporary relief, but sometimes they can be worth it. They can be worth their weight in gold, taking that little bit of pressure off the bunion. Orthotics, these little devices that go into your shoes, and they're good because they kind of maintain the structure of the foot. I always explain orthotics to my patients as this. After you receive braces from a dentist, they give you what's called a retainer, and that retainer kind of maintains the structure of your feet. And that's important to think about that. Orthotics don't improve your foot issues, except if you're having heel pain or things of that nature. But what they do is they help to maintain the structure of your foot. So if you have bunions, and if you receive bunion surgery, which we're going to talk about in just a moment, the orthotics help to maintain the structure and help to maintain the alignment of the feet. Let's go to another video. We're going to go to distal head osteotomy, and this is one of the most common procedures that foot doctors as myself perform on patients. In fact, I did one of these just a week ago. Let's go. Look at this. I mean, as you see the bunion, self-explanatory, a big old bump on the medial aspect of your foot. Tens of thousands of people walking around right now with painful bunions. Let's go to next step, excuse me. Incision is created. It's on the dorsal aspect of foot. Actually, there you go. They didn't show the incision, but as you can see, a piece of bone is removed, and that removes the big bump part of the bunion. Let's go to the next step. In this segment, the bone is actually cut. And a lot of people, when they hear about bunion surgery, they always say that someone has to break my bones or something like this. It's a surgical cut. It is a break, but it's a surgical cut in which the head of that bunion is shifted over to kind of put the toe in a better alignment and make the toe straighter for you. Welcome back to MyBadFeet.com, my show. I'm Dr. Maasi Smith, practicing foot doctor in Philadelphia, Pennsylvania. There's a 1-800 number there if you like the information I talked about. If you have to ask me more questions, you know, you can come in and see me in the Philadelphia area. There's a 1-800 number down, and you can reach me. Foot care from the doctor who cares. It's corny, but it's my motto. I don't care. I care about your feet. I want you to get the best possible information. In fact, if I didn't give you all the details you needed, go to my website, MyBadFeet.com. Ask me the questions that I may have missed, and then we can help you out together. Remember, my information is not to replace the information by your primary care doctor or any physician that you're consulting with. My information is just to help you better understand your foot problems. We're talking about bunions and hammer toes. So thank you. That's pretty much concludes my show, but we're going to end on a very, very different note. We're going to talk about my products. Now, MyBadFeet.com, you'll see I have foot creams, nail treatment, deodorizer, foot wash, and foot soak. And I've been on the show before, and we've talked about these products. These products are excellent for your feet. And what I'm going to do is, because I get a lot of response when my shows air, is that if you purchase my foot care system, I'm going to offer an additional nail treatment for free. Now, the best thing about this, a nail treatment is $40, and we all know with times and the economic crisis we're going through right now, is that everybody needs to save money. So what I'm going to do is I'm going to throw in a free nail treatment, which is going to save you $40, and I'm feeling a little happy right now. So I'm also going to throw another deodorizer and foot wash, which is another $10. So it's going to save you $50, and everybody can use the savings now and again. And I'm going to offer one now. I really appreciate you coming in and sitting down and talking to me. And I feel that you're sitting right here on the couch next to me. That's why I said coming in. Let's take another look. We're going to end on this part. I want to show you my blog from my website. MyBadFeet.com, I take the time and do these different blogs on different type of issues with people's feet. Like if you notice the first one, comfortable stylish shoes for women, part 2. And if you go down, there's a part 1. I do tons. Look at that handsome devil right there. That's me right there. But on another note, you can see I pull videos from YouTube teaching women how to actually walk in the type shoes, the difference between hammer toes, claw toe education. I just kind of go through a bunch of stuff, and you see me in surgery, diabetic neuropathy. I pull videos, and I just really try to put as much information as possible on my website for you. So again, if I missed the point, or if I kind of confused you, my apologies, but I'm working hard to get it right. Thank you for taking your time, sitting with me. Again, I'm Dr. Maasi Smith, and this was MyBadFeet.com, my first show, and I hope to have many, many more. Thank you very much, and have a good evening.